Welcome to our Melanin Hues podcast. We are women of color who are physicians and psychologists empowering our communities through candid conversations about their physical and emotional health. I am one of your hosts, Dr. Eunice Blackman.
Hi, and I'm Dr. Kenesha Campbell.
Hi, Dr. Leela Morrow.
Hi, Dr. Chanel Richards.
Welcome back to another episode. I am so happy that we're discussing this topic this time, invisible men, breaking the silence on Black men's health. Now, I know that we've all probably grew up with our fathers, our brothers, our cousins, and watched them, probably from when they was, at least with my brothers, I remember my brothers going to the doctor, but I can also remember by the time they were probably teenagers, school age, that they weren't going to the doctor as much. And more so, as I talk to my girlfriends about, my preventative care and my yearly exams, I don't remember talking to my brothers or my male friends about preventative care and yearly exams. Have you guys had some of the same experiences?
Oh, yeah. It's a huge issue.
I didn't grow up with men, honestly, but just in my day-to-day life, I think in general, boys just don't go to the doctor as much as girls do. And, boys don't have periods, girls do. And that leads to a lot of issues that brings them to the doctors as well. Girls need pap smears. There are different things, I think, that bring women and girls to the doctor more frequently than men. And then men just get out of the habit of needing to go and feel like they're healthy. So there's no reason to go.
Yeah, and growing up for me, I think it was only if there was something majorly wrong. And so it would be a man avoiding going to the doctor for years and years and years, but feeling chest tightening, shortness of breath, and then is placed on like blood pressure medicine. And so I just remember hearing more about that, but nothing related to preventative care. So I'm really glad that we're talking about this today.
When I think about it, many African-American men are just invisible from, the healthcare settings until, their health conditions become severe and they started experiencing things like stroke, dying from prostate cancer, which probably could have been prevented, and also from things like diabetes, simple things that can be prevented, but because they never really got to seek out the health care, those things they died from. And then when we look at the top 3 leading causes of mortality in Black men, we find that, especially between the ages of 45 to 64, heart disease, cancer, and unintentional injuries. And the number one cause is homicide for men that are 44 and younger. That's a mouthful to me when I think about those top 3 things. And in particular, our males that are 44 years of age and younger that's dying from homicide. I mean, I know what we've been experiencing in the wake of COVID and also in the wake of death of our Black men by police officers. This is very disturbing for me.
Absolutely. I mean, I think, for the younger Black men, gang violence and police brutality and, just the system of unjust imprisonment is what really is behind those statistics. And I think, unfortunately, what's behind the statistics for all the Black men, even the older ones, is really systemic racism and the fact that Black men in this country are really denied access. They're denied an identity. They're criminalized, demonized. Like, it impacts healthcare, but it impacts every other kind of part of their lives as well. So I think, the solutions to this problem are going to be really kind of on the macro level and on the micro level.
Right. That homicide rate, just looking it up in Philadelphia in 2020, it was the highest at 500 homicides. And in Philadelphia, there's a large African-American population. And you just think about, with everything that went on this past year, the lack of resources, people losing their jobs. I mean, so I think the statistic is just a reflection of many, many complex factors. And one of the major ones is, as you said, Kenesha, systemic racism.
I mean, absolutely. Black men and boys are dying, but Black men die younger than any other groups out there except for Native Americans. And their life expectancy is much lower than that of Black women and that of white men as well. It's like almost 4.5 years less than a white man. So, there are huge gaps and inequities that we really need to focus on to really improve the health of our Black boys and men in this country.
I agree. There also needs to be, we talk about prevention, the perspective on the medical system. They typically don't address things like we've been saying, everyone's been saying, they don't go to the doctor until they see an issue. And then by then it's too late. But for them, they're walking around, they feel fine, they're okay. They don't need to go to a doctor unless something is wrong for them. So there needs to be this whole shift in thought process, education on the utility or the usefulness of preventative care. It's almost like as though it's like a novel concept for many Black men.
Yeah, I think it probably is because, I think if you're always living on the edge, you're always like, just trying to survive. That doesn't really lend well to thinking about prevention. If you're always just like trying to get to the next, move on to the next day or, live another day. So yeah, I think part of it is just, their outlook on life in general for those Black men and boys that are, living kind of in poverty and things like that. So it's not going to be everybody, but I think racism does impact all of them. And regardless of if they're in poverty or if they're middle class or upper middle class, I think, there's similar issues across the board.
What I'm concerned about, I guess I want to know more about, is what make Black men disengage from the health system at an early age. I really try to understand why are they not as engaging as we are when we both go to, as a child, you're going to your well child care visits at the same rate. So I'm just curious about how do Black men become disengaged from that healthcare system at such a young early age?
That's a great point, Eunice. I have two sort of hypotheses. I don't know. Love to hear from you, Black ladies, what you think. But I think fear is one of them. In the culture, the Black man is not only presented as you need to be strong, but like in media, they're hypersexualized, their bodies look different from their white counterparts. And so they always have this kind of strong aura that they need to uphold. And I think there's a lot of fear because when you go to the doctor, something could be wrong, something might be wrong. And then how do you bring that back to your family and talk about it? And then secondly, I think there's just, overall fear that something could be wrong, and walking into the doctor's office with very few people of color around them, they're just not going to feel comfortable because they're at risk for those daily microaggressions or for something to not go well. So I would say fear. That's what I'm thinking.
I agree with that, Leila. I think the fear piece, especially like you said, they're hyper masculinized as well. And they're supposed to be the provider for the family and strong and not show weakness. And I agree that they don't want anything to happen that would, lead to them potentially having to show weakness or what they think of as weakness. I also think distrust in the healthcare system is huge. And that kind of goes to the lack of Black physicians in this country. I don't know if you guys have heard about the organization Black Men in White Coats, but it's like a really wonderful organization started by a Black male physician who basically just heard about the statistics about, Black male physicians and was shocked and decided to do something about it. And so he has a really big organization now that's working to increase the percentage of Black boys and Black men who go into medicine. Because honestly, there have been studies that have shown that Black men are more likely to do preventative testing and more likely to even do invasive testing if they actually have a Black doctor. It's important to have a Black doctor. So, that percentage needs to increase. And I think organizations like Black Men in White Coats are starting to increase the pipeline.
Yeah, I definitely think that increasing people who look like me would help our Black men, because looking at the statistics, I think Black males represent less than 3% of doctors. Unfortunately, that's a sobering number. No one wants to hear that, but it's true. But I also, going back to the thought of, why do Black men becoming disengaged? And in addition to the fear, I also think it's how they prioritize their health when we're talking about economic means. So if you are in a lower paying job, and I'm not necessarily saying that all men who are in lower paying jobs, but if you have a choice between going to the doctor and have to pay money for it versus putting, food in your child's mouth, I think that the choice is going to lie in you're going to forego probably a doctor's visit and take care of your household. So I think that may play a role into it as well. Maybe not the early on part, but as they get older and become men, I think that plays a part into it. And then when you see, as a young boy growing up, if you see dad not necessarily going to the doctor all the time, I think it comes back to hunt you in terms of your child, because now dad hasn't been going. So when I get 18 or 19 or whatever, my mom stops taking me to the doctor, I don't have to go. And so I think that modeling increases Black men's disengagement. I don't have anything that proves that, but that's just my thought process.
Yeah, I mean, I can say that I have a 20-year-old son, and it has been almost impossible to get him to go to the doctor since he left home to go to college. He just does not see the value in going to the doctors, even though he has gone to the doctor his whole entire life because I made him. Now
and
he's
his
like,
mother's a
And his
physician.
mother's a pediatrician.
yeah, I'm a physician, but as you all know, what you do has nothing to do with how your kids perceive you. I might as well not be an adolescent medicine physician. No, I don't know what I'm talking about. I just don't understand it. I don't understand it. And but he didn't. I mean, maybe it is because he didn't have the role models to say this is important for you as a man to do. But yeah, I mean, I see it already. He's only 20. And like, if I'm not on him, he will not go. And so I can, until he gets married, I guess, and has his wife tell him, I don't know, what's going to happen in between that time.
That is so interesting. Have you ever asked him why he doesn't want to go or what his barriers are?
Yeah, the barriers are he doesn't find it valuable. He does not see that he needs to go because, he knows everything. So like maybe, I don't know, it's his personality, but I think it's a man thing. They just like, I don't need the doctor. I'm good. Don't you see how healthy I am? I can figure this out myself. He's one of those types. So it's like, so until something is bad, so until he like sprained his ankle a second time and was not able to do what he wanted to do, that's the only thing that led him to go to the doctor because, his life was impacted then. He's like, oh, okay, I guess I'll go. All right, ladies, we have a special guest today with us. We're so excited to have him here. It's Dr. Eugene Harris III. He hails from our nation's capital, Washington, D.C. Currently, he's an emergency medicine physician in the Atlanta area. He served as medical director for several medical centers and is currently serving as the Southern Regional Medical Center director. He's a member of the American Board of Emergency Medicine, and he completed his residency at Detroit Receiving Hospital, where he was also a chief resident. So lots of accolades. He obtained his medical doctorate at Emory University of Medicine and is a proud alumnus of Howard University, where he graduated summa cum laude. Dr. Harris specializes in reproductive health and cultural competency, along with medical leadership. His goal is for all of his patients to feel as though they have a friend or a family member taking care of them on every encounter. What a wonderful goal to have, Dr. Harris. I'm sure everybody wants a doctor like that. So wonderful to meet you.
Wonderful to be here. I appreciate you guys. Thank you.
I think our listeners need to catch the essence. We have a smart brother. Did we not say what he graduated with?
We said it. Summa cum laude.
So
we said it.
You just got to know that we got a very, very smart brother amongst us, and we're so happy.
I'll let you all pat me on the back. I won't do it. I'll stay humble.
Somebody got to do it.
Somebody got to do it, honey. All right, Dr. Harris. Is there anything else that you would want the group to know about before we kind of start just digging in and finding out more about what you do every day?
No, I'm just, really excited to be here. So, shoot.
The ladies and I have been really talking about Black men's health, and the title of this podcast is The Invisible Man, going back to the book back in the day. But we just want to really talk about how we can move kind of Black men forward in terms of improving their health, their longevity. We discussed a lot of the stats earlier in terms of their increased mortality rates for kind of many cancers and reduced life expectancy. So we just want to hear a little bit about kind of your experience and what kind of strategies you use and, what tips you have to offer to our listeners today.
Very wonderful. I think before we can talk about Black men's health, honestly, as a physician, I think we actually should talk about, how Black men are actually going to medical school less and less throughout the years. There's been some studies that show that people respond better to physicians that look like them. That's a known fact. It's not a racist thing. It just is what it is. If I can use me as an example, I've seen in Atlanta over the last 10 years, 3 physicians. 2 were Caucasian, 1 was African American. I went to the 2 Caucasians first, and both were referrals. And I just didn't get the warm vibe that I was expecting. One of them actually seemed more threatening with some of the prescriptions he wanted to give me. Like I'll give you an example. Even though my hemoglobin A1C, the thing that we track to see, how you're doing as far as diabetes, was 5, which is well under, anything worrisome. He said, well, I ought to put you on metformin because you're going to be a diabetic. And I was like, whoa. I was like, sir, you need to calm down. I'm a physician. And it was very threatening. And he was like, when you're overweight, he was very condescending. Now, I didn't respond well to the prescriptions he gave me. My blood pressure was high at the time. I was hardly taking medications just because I just didn't feel as though I was treated in a way that made me feel comfortable as a patient. And so I switched physicians. Now I'm going to, a really great guy, about 10 years older than me, African-American. And he spoke on my level. He said things that made me feel comfortable. And when he gave me a prescription, he said, look, brother, you need to do this, this, and this. He was like, you know better because you're a physician. And I said, you're right. and I've been, doing well ever since. So my point is, where are we as physicians, as Black men, to take care of our Black male patient population? I looked at a recent article that was in Forbes, and it stated that I think the year after I was born in 1978, I think they said 2.8% of enrollments into medical school were African-American males. Mm-hmm. Fast forward to 2020, it was 2.9. Mm-hmm. So it actually went down a little bit as far as the percentage of us enrolling into medical school. It's like, well, where are we? Our sisters are making great strides in medical education, but we've kind of stayed stagnant. And I think that's one thing that has really affected the Black population as far as our health disparities, is that we're not represented in medicine. Unless you're in DC, Atlanta, or some other, highly populated, Black areas, your physician's not going to look like you, in which case you may not respond well to the person on the other side of the bed.
Yeah, absolutely. We totally agree. I'm in Philly, and even though it's about, 40% Black, we have very few Black physicians here. I was just looking for a physician myself, a specialist, and there were none. I was like, are you kidding me? Like, I could not find a single physician in that specialty who was Black in this area. And so we did discuss that earlier, and we totally agree. I mean, we are on the same page, but what do you think can increase the rates of Black men kind of in medicine? Like, what can we do to really excite Black men about medicine?
Well, I think it's gonna take the Black males in medicine to step up a bit. Even myself, I've been thinking about this a lot lately. And I do want to maybe start a nonprofit to try to increase awareness of, Black college students getting into med school. Like, we need to get ourselves out there in front of students more. A lot of us in medicine now are usually first generation successful. I know in my family, and a lot of my colleagues, our parents were sometimes the first to go to college in their family. We are the first to go to graduate school in our family. That looking back and trying to pull the others, where we are, I think is that next step in where we are as a people. And so I think it's on us as Black physicians to start our reach back. We made it, yep. so to speak. And so it's our job to now pull the others along.
I mean, I definitely agree with that. I mean, I really like that idea of starting a nonprofit to help bring others along as we have come. So, if it's not us who's going to do it, then who will do it? But I did want to go back to one point, because I think you said something that was so striking about, the white physician that was your doctor and how he made you feel when you go in. And the point that I want to make is, here it is that you're a physician. So you kind of know some of the stuff that he's saying. Imagine if you're not a physician. Mm-hmm. Imagine if you're just someone who doesn't know, and they go in and they hear that. I mean, I think that that's part of the reason why I'm not going back to the doctor, because he told me I needed this, this, and that. Something internally might have said, you don't really need probably all of that. But it's coming from a doctor, so you trust that. And then you go to see someone else who says, well, you probably don't need to be on these medicines, So that's kind of concerning.
Right. And just speaking, I'm take the doctor coat off. Just as a Black male, historically, it's a tough position to be in. There's been this constant historical attack, and on the Black female as well, obviously, but I think in two different ways. We've kind of, as a men and women as Black folk have been torn apart, almost to battle each other a little bit. But it's obviously there's a lot of historical things we could talk about, but just speaking as a Black male, it's one of those, now we've gotten to the point where we're almost defensive, and we don't want to be told, like we were told in slavery, we were told in Jim Crow, we were saying we weren't adequate enough. And now that we're quote unquote free, it's one of those, well, I don't want to be talked down to. I am a man, and sometimes it is intimidating to go to this person who has this white coat on, who's supposed to, is automatically usually coming in the room with the air of bravado of I'm better than you. And you're like, well, hey, I need a little bit of help. I'm going to humble myself and ask this doctor to, do these things for me. And because that physician usually isn't looking like you, it comes across as you being berated or being talked down to. And a lot of Black men take offense to that. If I'm getting beat up all day, I'm definitely not going to get beat up by the person I'm asking for help. I just choose not to go. I'll just choose to ignore these health issues or how I feel, because I don't want to be, again, talked down to, told I'm doing something wrong. It's a double-edged sword. Obviously, our health disparities and our access to healthcare, the fact that, we have fewer resources in a lot of our, tightly packed communities aren't as good as, other communities and other, races. But on the flip side, we need those things. We have to go because we're actually harming ourselves by not, seeing the physician. So it's just a tough position.
Yeah, we appreciate what you've shared with us so far, Dr. Harris. And, you've brought up a lot of the most important barriers as to why Black men don't seek care. So on our episodes, we really like to offer strategies and tips to our listeners. So what can we do as a community to encourage Black men to seek consistent health care?
My advice to a lot of the brothers that I personally see, and especially when I have a Black male patient and his wife's in the room, I let him speak, and I was like, hey, has your wife been telling you should come? And he'll be like, nah. And she's shaking her head, yeah. I was like, hey, man, you all are a team. Listen to your wife. She's been telling you to come in. You're just gonna get worse.
Right.
But obviously that takes that one-on-one communication that I'm able to reach a certain level with my patients that I don't think some other races, not that they're not good providers and good physicians, but they may not take that time to know the cultural aspects to kind of address in the room. So again, I think, strategy number one, we need to be more present as physicians. Strategy number two, we really need to, within our population, really hone in on, hey, if you have a spouse, you're all a team. When she makes her appointment to see her OBGYN, you need to make your appointment to see your doctor too. We'll skip a year or two if you let us.
Or 5.
Yeah. 6, 7, or 8.
I think we need to, as physicians, do more health fairs because that's a easier way to get access to our people. We're usually going to, pre-COVID, we're going to go to the mall. We're going to go out to the park. We're going to try to go kick it. But when we are out in those social settings that we enjoy, going to and being around our people, because we're very social as Black people, trying to increase our medical awareness there and go to the people, I think is a very good strategy as well. Because I've had a lot of success, finding, people that didn't know they had high blood pressure, didn't know they had diabetes at health fairs, but we don't do enough of them because, trying to send a flyer to people's house saying, hey, I'm the new doctor in town, usually isn't going to get it, because there's a barrier for that man to reach out to that doctor. Because of some of the things we already discussed. But if we as physicians go to the people, we oftentimes will make better strides. For instance, during COVID, one of the physicians that we know, actually, he just set up his own testing center, but he made it mobile. And so we were going out into, downtown Atlanta and doing testing where people could be in their car. They were already driving by. They had no problem stopping there, but we had to go to them. They weren't going to come to us. I mean, that's a cultural strategy that I think, us as physicians can extend more and do a better job within our community.
So ladies, you heard it. If you got a spouse, bring them on out because you know he's going to want to stay in that house. So bring them on to the doctor.
I mean, the connection is so important that you're talking about, Dr. Harris. The trust in the physician, him or herself, or the physician community is very important. You know, along those lines, I mean, we were just talking about the scarcity of Black physicians, Black males and females. Only about 4% of physicians are Black. And so what can other physicians do to connect to people who don't look like them, to connect to people who are from different backgrounds so that they can actually get them to trust them so they can actually, you know, do what they tell them to do really and get better. I mean, that's what you really want. You want them to follow the medical advice.
This year, I think with a lot of the Black Lives Matter, you know, things that happen and some of the awakening of other communities to the African-American plight, I think things may have an opportunity to get better. But that takes other communities kind of opening their eyes to the fact that there are disparities. And I think, probably 10 years ago, if I told one of my white counterparts, I was like, well, you know, in our community, X, Y, and Z happens, they were like, well, I didn't know that. You know, if I told them, it was like, well, I think there's a reason why Black men die of prostate cancer more than white patients. They were like, well, I don't understand why. It's like, well, there's this stigma with Black men about their anus, that if it gets touched, they're automatically gay. You know, they're like, what? They're like, what are you talking about? I'm like, I don't know why it's true. I just know that it is. But it's just like, I think, I think we have to have more open and honest dialogues as physicians and just as people in general, so that we understand our differences. And if we understand our differences, we can kind of make adjustments of how to talk to people. You know, like for instance, when I see, patients who are Muslim, and they're dressed in very traditional garb, I'm very aware to address her husband first, out of respect, and ask me, can I examine your wife? I don't agree necessarily with that practice, but I'm going to extend what I think is respectful for their culture so that I can gain access into the truth information of why she's there. You know, if these people don't feel comfortable, if I go in and I'm just, hey, lift your gown up, I need to see your belly, or put your hijab down, I need to see your whole face. And I don't try to break that barrier of I'm your physician. I want to make both of you comfortable first. I'll never get the true reason of why they're there and be able to help their problem. So I think we have to be culturally aware. I think there's some groups and populations that are a little ahead in being culturally aware.
Yeah.
But we have to try to help our other counterparts in medicine along.
Yeah, that should be Doctrine 101, but it's not. So well said. Definitely something that everyone needs to practice. So I want to get into a little bit about what the actual illnesses are that you see in your emergency department on a regular basis. Like, what are Black men coming in with that you think could have been prevented if they had, received appropriate well checks?
Definitely a lot of end-stage renal disease. And obviously, hypertension and diabetes, had gone unchecked for years and years. And actually seeing in the African-American population, I'm seeing, end-stage renal disease where people are on dialysis at much earlier ages than I'm seeing in other populations. I'm talking about 28-year-olds who are on dialysis. I had he was 29, I had a 29-year-old the other day who had a stroke. And so we're seeing these things in much younger populations in African-Americans, in particularly males, I'll be honest with you, than other populations, because we're just not going to the doctors. We're letting things go without being checked for years and years. And then it's already fallen off the cliff by the time we find it. And those patients then are angry and bitter because they're like, well, nobody told me, now I'm sick. And then there's this level of, this cycle of depression and it just gets worse and worse and worse. It's like, well, if we would, after that last pediatrician visit when you were 18, you should have just switched over to a primary doctor and kept it going. You was going when your mama was taking you. Like, why did you keep going?
Oh,
so
boy.
True.
Transition of care.
That is definitely true. And I just want to know, as a pediatrician, what can I do? Because the most of the kids that I actually see are kids in foster care. So I may not see them again. But what can I do to say, hey, look, when you leave me and you turn 18 and you leave your household, I need you to continue to see your doctor. Like, is there something you think I can say or, do for that population?
Honestly, I would suggest maybe having just a network of family physicians and internal medicine physicians that you automatically have a relationship where you start feeding them into their practices. So I think that probably should be a standard of care probably in pediatrics. Thinking outside the box, just off the top of our head, I think that would be great. Just to say, hey, out of my practice, my patients usually go to one of these 4 people. These are who I usually send people to once a year. Do something for them. Their practice. Say, hey, here's lunch, here's breakfast. I want to keep you as a referral stream. To keep people coming from my practice to yours. I think that would be a great continuity of care.
Yeah.
That's awesome. Thank you.
Absolutely.
And piggybacking on that question, as a psychologist, how do you talk to your patients about mental health, since we know so much of their physical symptoms are related to their mental health?
As an emergency medicine physician, I'm in a strange position when it comes to mental health. I'm usually seeing people when they're at the crisis level. And so unfortunately, I don't get to have a lot of the conversations with people when it's in a phase where I can easily set them up with just, primary mental health referrals. We're usually at the point where the person is actively suicidal, actively psychotic, in which case it's a little bit of a challenge from my specialty in particular. But obviously, with the amount of people with mental health issues in our population that goes unchecked, again, because of the stigma of it, where I don't want to be labeled as crazy, we as physicians need to get some outreach out to the population, so especially with depression. My roommate in medical school actually is in New York. He just got a grant where he's actually now going into Black churches and talking about mental health issues, because he's a psychiatrist, and talking about depression in the Black community and how the church can help with that. And so I think that would be a good avenue, nationwide with psychiatry, just to get out and say, hey, let's hit these churches. I think in general, one of the big messages is with Black folk, you almost have to come to us at this point where we are. With health fairs, go to the mall, go to the big concert events, be outside handing out some flyers. With mental health, really go to the church, pass out flyers about depression. You're not going to get everybody to call that number, but you might get 1 or 2 and saying, hey, I know you're here to get the Holy Ghost, but in case you're having, these thoughts of, I'm not good enough, I'm not smart enough, I'm feeling bad about myself, I'm driving home crying, I'm very upset and I don't know why, it's okay to get help. And so you just give them the flyer, and eventually you're going to get somebody to kind of change their life.
You're just right. I mean, I think a lot of the issues, again, go back to lack of trust, just guilt and shame, all the stigma associated with so many things within the Black community. Same thing with HIV, what that leads to. So, I mean, I love the idea of going to the Black church, like get the pastors on your side. Because I mean, if I talk to one more person who tells me that like God is going to, fix it, and that means since God's going to fix it, that means that I don't need to get any care at all or any help at all. Now, I'm Christian as well, so I believe in God and I believe in healing and all that. However, like God put these people on earth for a reason to help you, okay? And the bottom line is, like, I think, especially for mental health, people don't even think it's real. So a lot of people are like, oh no, that's just a spirit. Just pray it away. And I'm like, but that spirit is going to lead them to kill themselves. And it's really, really important that they get, treated appropriately for whatever they may have. And so I do like the idea of going to the church. I think that's an amazing idea that needs to happen more. So your friend is definitely doing some great work.
Yeah, absolutely. You definitely have to get the pastor on your side to speak to his flock, because, they're not going to make any sudden movements without, my pastor said, but your pastor is not a physician. So I totally understand that. So I like that idea.
And if I hear one more of our people say, well, I'm not going to claim that. Yeah. I was like, well, unfortunately, it claimed you today.
It already claimed you.
So let's talk about it.
My family's the same way, friends. I mean, it's a real issue. It's a real issue. But I will say that for physicians and providers, if you can connect to people and say like, I'm a Christian too. Like, I understand where you're coming from. However,
all the time,
this is, what's going on right now, and we need to deal with this. And I'll be prayerful with you that like the outcome will be the best outcome that it can be, but we still need to take care of it. Like, it's here, it's happening. And obviously, just because you're a Christian doesn't mean you can't get sick. Like, that's just not how it works. It is really important to connect with your patients and their families on a human level. And I think if more of us would do that, like you are doing, thank God, because I don't want to talk about adult providers, but I actually have had very bad experiences recently. And I'm like, what is going on? Adult providers need to be more humanistic and just connect with the patients on their level so they can feel comfortable and be really trusting of that interaction and listen to what you have to say. This was wonderful advice and wonderful insights from you, Dr. Harris. We're really, really kind of blessed to have you on the show today. Before we finish, I know you're emergency medicine, but what preventative screenings would you actually recommend for Black men to get?
Definitely. Prostate exams.
Mm-hmm.
Okay. That prostate cancer is killing us at enormous rates, and it's a completely preventable thing. If it's something that if you just start getting your PSA monitored when your doctor wants you to, and if your levels are high, get your rectal exam, let them check your prostate, get these things checked out before they become big issues. Definitely also, blood pressure screenings, diabetes screenings. I think those are probably the big three that would definitely make our health astronomically better. Heart disease, strokes, end-stage renal disease, those are all tied to your blood pressure and your sugar levels. And those are things that are easy to check, and there's no reason to not get those looked at.
I'd be remiss not to bring up the diet in some Black communities.
I'm guilty of that one a little bit. I have to remember I'm still a Black male myself sometimes. I'm guilty of a lot of things that I preach against.
I would just love for Black people in general, I'd say, but especially the ones that love that Southern cooking, to really kind of work on healthier ways to prepare those wonderful foods, which there are many healthy ways, and just also being physically active and like just basic things that we can do when we're, start doing when we're younger, instilling in our children and our, loved ones early on that can help prevent some of these like chronic illnesses later on down the road.
Yeah, now I will say, one thing, it was the first time I did it personally, but my church did a modified fast for 3 weeks in January where we went vegetarian.
Mm-hmm. Okay.
You did a lot of stuff, and no social media also. That was another. and actually I lost a little bit of weight, and I was like, I actually was enjoying eating some non-meat dishes.
Mm-hmm.
And so, maybe, I'll start with some patients who are very, religious that you have, that you kind of get that vibe that it's a faith thing. It's like, okay, well, how about maybe 3 times a year, 4 times a year, you do a 2-week fast. You increase your Bible reading and you're only a vegetarian, and see how it changes you. And then year by year, they may say, okay, that wasn't actually that bad. Maybe I'll make some changes in my diet because I actually felt pretty good that week.
Mm-hmm.
And I didn't feel all heavy and bogged down. So, we just got to use what you have. It's like if you got a patient who's very religious, use that route. If you have someone who's very, non-religious and, they just want to straighten their face, be very straight in their face. Hey, you're overweight. We need to make some changes. And use a lot of we.
Yeah, right.
So that they don't feel like you're jumping on it. Like, we need to make some changes. It is what it is.
They're like, we need to do it. Okay. All right.
So here's the game plan. Can we do this?
Right.
I use a lot of we with patients because I don't want to be like, I'm the doctor, I got this code, I'm telling you what to do. It's like, no, we need to work on this. Here's your plan. Yeah, I may never see you again as an ER doctor, but I'm coming up with a game plan for you. And so can we do that?
Yeah.
And
that's
so
wonderful.
I do a lot of asking the patients instead of telling them.
That's wonderful. That's
Great
wonderful.
strategies.
Mm-hmm.
I really like them. I mean, very similar to some of the strategies that we use in therapy to connect and make change happen. And I'm so glad to hear that you are doing that as a physician. And I think where it needs a lot of work is the education in medical schools. Nisha mentioned Doctoring 101. What training are you getting to actually have those people skills to be more human again? Very important.
Yep, absolutely. Absolutely. I actually just started mentoring a Black college student, and she was actually saying that she was concerned and felt like she didn't want to be a doctor because of her experiences with doctors and the fact that they're not very humanistic. So she was like, oh, this is not at all what I expected. Like, they're not connecting to the patients, and I wanted to connect to them. And, I had to reassure her that, look, there are doctors who are very humanistic. You just need to be the doctor you want to be. And you need to choose whatever specialty you want to choose where you're surrounding yourself with people like you. So it is possible, but it was a little disheartening because she was just like, I just don't think I want to do this. It's really wonderful to have you on here today, Dr. Harris. You have been such a wonderful example for us all. Like everything you said has been inspiring for me. And I really hope that, you develop that company that you're talking about, where that nonprofit, where you're going to actually, start to really increase that pipeline and bring up other young Black men to want to be a doctor like you, basically. I mean, that's really the way to do it. Be the role model so they want to be like you. So that's really wonderful. And I think it's just a powerful thing. And I wish you the best in that.
Appreciate it. And so I'll come back in a year's time from now. We'll talk about my nonprofit. How about that?
Awesome.
Hold me to it.
Sounds
Love
good.
it.
We'd love to have you
Sounds
back.
great. Thank you so much for your time.
Thank you very
Thank you.
much. We appreciate it. All righty. Great to see you. Thank you all for listening to our podcast today. I hope you enjoyed our special guest, Dr. Eugene Harris. Please follow us on Instagram and Twitter at Melanin Hues Podcast. Please like us on Facebook at Melanin Hues Podcast. And for more information, you can go to our website, melaninhuespodcast.com. We're looking forward to seeing you all again for our next podcast, which will be on Black maternal health.